You know, it's 3 o'clock in the morning and I look like I've been crying, but I promise I have not shed a tear today. And I don't know what kind of allergies I have, but yo, I've been rubbing my eyes for a long period of time. I've taken Benadryl, I have taken allergy relief, and it's not really even a dang thing. Okay, so trust me, I have not been crying, and it's mad late, so I'm talking low. So I don't want you to think that, you know, I'm crying, I'm depressed, I need to go see a psych ward. It's not that serious. I'm like kind of disappointed in myself because I don't like making these kind of videos, but YouTube is a form of therapy for me because it helps me vent. It helps me get out what I need, because I'm a very I wouldn't say I'm very introverted, but difficult things I like to keep it to myself. I don't really like to let other people know what's going on, and you know, that's from past experiences. You know, I figure like the more ammo you give people, the more chances you have to get hurt. As crazy as that might sound, that's what has been happening to me and what has happened to me. So that's how I move forward in life. The very important things that could really hurt me, if you throw it at me, I keep it to myself. And the things that I don't really care if you know, I don't really care what you do with it, I'll let you know. So yeah, I was scheduled to take the NCLEX this month actually. Actually, tomorrow would have been the day that I would have taken the NCLEX, and I was for sure that I was going to pass. I worked my butt off. I answered so many questions, I went dizzy. And it's sad because I end up pushing the date back because I just didn't feel confident in myself. I didn't feel like I knew enough to pass. And it's like now that I like pushed the test back, it hit me because I was just like, are you questioning how much you know, or are you questioning if you're capable? If that makes any sense. And I don't know. I don't know what I'm questioning. For as much information that I have gotten over, like for as much questions that I've answered, for as much categories of pharmacology that I've put together, I shouldn't question the fact that I know enough. So I guess I'm questioning if I can do it. I'm questioning if I can do it. And if you would have asked me last month, I would have gave you a confident yes. I can do it. I got it in the bag, like no doubt about it. But now you ask me, do I think I can do it? And I don't know. I don't know if I can do it. And I guess that's the problem when you're a multiple test time taker. It's like that self-doubt is highlighted. I mean, like this back of this wall is like highlighted because you know what you did last time, and then so you try to up the ante this time so that you don't feel how you felt the last time. But this test, this NCLEX test, when it's your livelihood, it it will highlight your fears, definitely. You know, your fears will be highlighted by this damn test. And you know what trips me out the most is that it tests minimum competency. This is like basic stuff. But it's like walking on fire. I don't know. If anybody else can relate to me, please leave a comment down below. And I would really like to conversate with you on this. Because maybe I'm a little dramatic on this. And maybe I'm just blowing this all out of proportion. But it's how I feel. You know. And if you feel how I feel right now, please let me know. I would greatly love to conversate with you on this. Because, yeah. Please watch out for these fake friends. And these fake, I hate to say it like this, but these fake friend nurses that you may have. And I'm talking about the ones who are already in the field. Okay. I hate to say this. Like, this burdens my soul to talk about this. But somebody need to talk about this. It's not this cookie cutter, oh, we all want to save lives kind of world out here. Okay? You might go into this profession with a good heart. But there's a lot of people in this profession, in this field, who out to get these coins and don't give a damn about anybody that gets in their way. Okay? I have a problem with NCLEX. This is not new information, okay? And what baffles my mind is that majority of my friends are in the healthcare field or are nurses. Okay? And the amount of people who have offered to help or who have answered my questions to help me, you know, further along this troubling journey of mine is slim to none. You know, it just baffles my mind. Like, I actually have an RN friend. She is such of a good nurse that she's not even in the field. Like, she's in the field, but what I'm trying to say is she's more like teaching now. You know, she's not really like hands-on, you know, taking care of patients. That's how good she is, okay? And when I asked her to help me with my NCLEX, I'm laughing because my anger is about to skyrocket in a minute. And I have to laugh to suppress the devil that wants to, like, do a Mayweather right now. Okay? So, she had the audacity to tell me that maybe RN is not where I need to be. That maybe I should start as a CNA or LPN. Now, if you are an advisor, you know, you see somebody new coming into your office and they're having a troubling time with their license exam and they don't know which direction to go, then you suggest a lower level. Maybe the level you're trying to get at is just a little too much for you right now. So you need to scale it down a bit, relearn things to help your confidence build so that you can go to the top. But if you are a friend and you see another friend struggling, what kind of friend are you to just watch that person struggle? What kind of friend are you to just watch them burn and not even lend a hand? Like, I'm sorry, if my friend had a BSN like me, and they had a trouble time, they having a hard time with the NCLEX, like me, I would say, girl, let's get together. Let's start answering these questions. Let me figure out what's wrong. Let me figure out how you think. You know, because, you know, when you start getting to the hard part of the NCLEX, the analysis part, you know, that's critical thinking. Let me see what your critical thinking level is at. You know, let's see how you could possibly get to the level that I am one day. You know, it's like it's not tiny at the top. There's space for everybody. There's space for everybody to make money at the top. So you don't have to hold on to your little space because you scared somebody gonna take it. You know what I'm saying? Like that's one of my issues too with these old ass nurses in this one field that they've been in for their whole lives, and they see that brand new nurse and they just want to like throw her to the wolves. They just waiting for this girl to mess up so that they could keep their spot. What kind of person are you? And should you be in this field? Like I've seen it with my own eyes when I do my clinicals and I see that brand new nurse, and it's like if there is 12 nurses on that floor, maybe one will help her, maybe one. And I understand you got so many patients, you don't have time to, you know, help somebody, but I feel like you're not a nurse if you don't help somebody from making a mistake that can ruin other people's lives. I feel like the number one reason someone should be a nurse is to advocate. Advocate. That's like the number one rule to me as a nurse. If you're not willing to stand up for your patients, if you're not willing to help somebody who's taking care of a patient, whether you're getting paid to take care of that patient or not, you know what I'm saying? Like, why wouldn't you take just a couple of seconds or a couple of minutes and make sure that this girl not only ruins her career, but she doesn't ruin a life on the way down? I had to make this video. I had to. It's been on my chest for so long, and I'm so tired of these fake ass people, excuse my language. I'm tired of these people getting rewarded for garbage, okay? I'm not saying they're garbage, but their personality, the way they're acting is straight garbage. Garbage. And it's no wonder why they always say there's a shortage in nursing. There's a shortage. No shit. No shit. Really? There's a short. Why is that? What? Is it because a lot of people go in this field thinking they're going to get paid buku bucks, and then they realize what they're doing for the money is not worth it? So then now they're miserable. Everybody around them is miserable. If you're going into nursing for the money, you need to reevaluate yourself. Stop. Stop before you apply to any nursing school. Stop before you apply to go to take your NCLEX. Stop it. Stop it. Just stop it. If you're going to actually try to make a difference, you know, when you see somebody hurt, you kind of jump into action. You want to get involved. You don't want to just be, you know, the onlookers. You know what I'm talking about, the onlookers. They see you in an accident, but they just doing this, which I've seen plenty of nurses do, by the way. I've seen them remove stethoscopes and all that good stuff. And I understand the Good Samaritan law don't cover everything. I get you, boo. But if you can look away and not feel a damn thing, you might want to reevaluate if you want to be in the healthcare field. Not that I'm getting completely off topic, because I just wanted to talk about the fake friends. Okay, they act like they're there for your success, but they're really not. Okay, a real friend would have not deterred me from my NCLEX exam. They would have encouraged it. They would have promoted it. Hell, on their days off, when they're not sleeping or doing something with their families, they would say, hey, meet me at the library, or can I come over? Let's do maybe 20 questions. They will encourage your success instead of telling you you should go for something less. Like my friend who told me I should go for an LPN or a CNA or a PCA, Patient Care Associate. The fact that could come out of her mouth and she can call me her friend, something's wrong with her. Something's wrong with her. Because I could say that to somebody I don't know. Because I don't know their struggles. I don't know. I haven't did my assessment. You know? But for somebody who I call friend, and I tell them to go for something less than what they should be at, I'm not their friend. Okay? And just because you guys share the same education, don't mean that they're out to look out for your benefit. It does not mean that. Okay? It's a dog-eat-dog world out here. And I hate, oh my goodness, I hate to say this, especially being a black person. Black on black, we should be like this right now. Okay? Because they chopping us off like we don't matter out here. Okay? Every time I look on the news, a black person is getting shot up. And there's no repercussions for it. Right now, black on black, we should be arms in arms right now. Okay? We should be dropping stuff just to help another black nurse out. We shouldn't be diminishing them. We shouldn't try to dim their light. This is the time right now to make them feel like they can do anything. And they can do anything because I got your back. I'm not going to let you drown. If one of us know how to swim, we good. We good. You know why? Because I'm going to teach you how to swim. I'm going to teach you how to swim, and we're going to be all right. Not, oh girl, you better learn how to swim, girl, because I can't carry you. You know, you better learn how to paddle. You better go to that YMCA and get them classes, girl, because I can't. What? And we're supposed to be in the healthcare field. Please, please, please. Whenever you're trying to upgrade your life, whether it can be nursing, whether it's in business, whether it's in art, whether you're a chef, whether you're a teacher, you need to reevaluate who's standing next to you. You need to reevaluate who you call friend. You need to reevaluate who you think are your support. Because just like a tire that you feel like is brand new, shouldn't give you no problems, it could blow out on you like that. And ever since I've been trying to upgrade my life, I've been seeing friends blow out on me like that. They're here one day and they're gone the next. And I don't mean death. I mean shit, death to me. Rest in peace to them. But please, don't tell everybody your business. Keep it to a minimum, okay? You can let people know that you're having a little issues with your NCLEX, but don't give them full details, especially if they don't look like they're going to help you. So I had to vent out here, you guys, and I really hope you like this video. You know, let me know if you like me, you know, keeping it real. Okay, so again, I apologize for how I look, but you know how sometimes you can't always look pretty. I'm gonna be real. You can't always look pretty. You can't always be makeup up, you know? Like sometimes people need to see what you look like under that. And unfortunately, not everybody look good under that. So I'm glad to know that, you know, my skin still look clear. I look tired, but that's about it. So guys, I love you. Please leave a comment, subscribe if you want to, and stay tuned for more videos. I should have another one out. I'm not sure if I'm going to be doing it on natural hair or nursing, but I had to make a video. It's been a week already, so thank you for watching. Love you.